I would like to thank the organizers for inviting me to talk about whether CSF alpha-synuclein is a useful biomarker for Parkinson's disease. My name is Dr. Alcalay, and I work out of Columbia University. These are my disclosures. And I'm here to represent the no for the question of whether CSF alpha-synuclein is useful for a biomarker for Parkinson's disease. Now, in order to convince you about it, let's first talk about what is a biomarker. When we say that something is a useful biomarker, what does it mean, useful biomarker? So a biomarker can be used in three major scenarios. One would be to diagnose Parkinson's disease. So you do the test and you get, do you have Parkinson's, do you not have it? For example, for herpes encephalitis, you do the PCR in the CSF. Do you have herpes encephalitis or do you not? A second type of biomarker would be to monitor Parkinson's progression, right? So if you want to see whether the disease is worse, we can monitor that biomarker, for example, creatinine for renal function. And a third useful use of a biomarker would be in clinical trials when you want to see whether the drug works or not, and you can use that biomarker as a secondary outcome. The drug may have helped people with Parkinson's, but it really helped their biomarker. So let's see whether alpha-synuclein is useful for any of these three. And let's start with diagnosed Parkinson's disease. Yes, Parkinson's, no Parkinson's. And a lot of the data that I'm going to present is from the Michael J. Fox Foundation-funded study, the PPMI, where they collected so many great biomarkers from CSF that are pretty useful to follow. So in the PPMI study, when they first look at alpha-synuclein levels in picograms to milliliter in the CSF, they show that there is a reduction in Parkinson's compared to control. So if you look at the left panel, there's 4 boxes. The PD plus with or without ApoE4 are the two ones on the right. And you see that the mean alpha-synuclein levels are a little bit lower than the two leftmost boxes that represent healthy controls. But you see that the differences are not that great. And here they show that stratification by ApoE4 does not change much. When you look at this, look, for example, at the value of 2000. And you see that the value of 2000 can be present in all 4 boxes, with PD, without PD, healthy controls, with and without ApoE4. So imagine that your patient gets a result that their alpha-synuclein level in CSF is 2000. What do you do with that result? Of course, this is not very useful. A more useful, potentially more useful alpha-synuclein measurement would be to look at seeding aggregation assays. And this slide is taken from the Biofind study, another Michael J. Fox Foundation-funded study, where seeding aggregation assays from Biofind were performed in 2 different labs, and the results were remarkably similar in both labs, where there was quite good sensitivity and specificity. So if you can see, we want all the green to be in the negative in the controls, and all the red to be positive. That's the Parkinson's patients. You see that there are some Parkinson's patients with a positive, some controls with a positive result, and there are a few Parkinson's patients with a negative result, but sensitivity and specificity are high in the 90s, as you can see in the table in the right upper corner. So I would say that ArtyQuick is more promising than just general alpha-synuclein levels. But where is it coming from? Another study from Spain looked at ArtyQuick in their cohort that included LRRK2 mutation carriers. And there they showed that the sensitivity is 90%, specificity is not as great as 80% in idiopathic people. But when you look at people with LRRK2 mutations, you get a little bit of a sense of what this biomarker is good for. 40% of their LRRK2 PD and roughly 20% of their LRRK2 patient carriers without Parkinson's were positive for the ArtyQuick, which means that most people with Parkinson's and LRRK2 were negative to the assay. So what is the assay really measuring? Does it measure yes/no PD, or does it measure yes/no alpha-synuclein? And in contrast to those who were diagnosed with Parkinson's, 3 people without Parkinson's were also diagnosed with a positive ArtyQuick. So we'll have to talk about it later, but clearly as a biomarker has some challenges. The second useful biomarker usage would be to use it as a monitor for disease progression. So would alpha-synuclein be helpful to monitor disease progression? If we look at the ArtyQuick that we just discussed, it's really a yes-no study. So there's no progression measurement that can be measured currently with ArtyQuick, so that's not relevant. Let's see what happens in alpha-synuclein total levels that I showed in the first slide. And this is, again, a graph from the PPMI study. And in red are Parkinson's patients, and it shows the level of alpha-synuclein in the CSF over time. And as you see, the levels may be going down a little bit in the first year, but then they're quite stable. Not a good marker of disease progression on its own. This is, when compared to healthy controls that we showed, this just shows the mean concentrations. Remember that there is a very big overlap that I showed, but the mean concentrations don't change over time. Interestingly, when we look at people at risk for Parkinson's, those with aposmia to start with in this cohort, and there were like 26 of those, have a lower alpha-synuclein already. So they did not even develop motor Parkinson's, they're already lower, to argue that it's not a very good marker of disease progression. The last use of potential biomarkers would be to use it in clinical trials. And this is really innovative because we're still challenged whether alpha-synuclein can be used or not, but it was used at least in one study that I'm familiar with, and that's Umbroxel. Umbroxel, this is a study that was published from the group from London in 2020. Umbroxel is a compound that may make glucocerebrosidase, GBA, enzyme more stable. On the left, they show that when they give the drug for 886 days, when they measure the activity of the enzyme in CSF, for reasons unclear, it goes down, and that's figure A. But the figure that I wanted to show you is figure B on the right, where they show that the people that were treated for 186 days, alpha-synuclein levels in CSF went up. This was interpreted by the people who done the study, that this shows that the drug works because alpha-synuclein goes up, maybe brings the mean alpha-synuclein levels in CSF from the Parkinson's level to the controls level. If you're convinced by this argument, you would say that alpha-synuclein is indeed a very good biomarker for clinical trials. So just to summarize, is alpha-synuclein a useful biomarker? If you want to diagnose Parkinson's disease, total levels are just don't work. You saw the major overlap between people with Parkinson's and controls. Maybe if it would be added to a larger panel in the future, it would work, but currently no. ArtyQuick, much more promising and maybe a marker of alpha-synuclein pathology, but still there's a lot of people that fall into the false positive and false negative that we need to further understand why. And specifically, a small study, but shows that LRRK2 carriers, for example, may be negative for it, which means that maybe it doesn't show yes-no PD, but rather shows yes-no alpha-synucleinopathy. Remember that over 30% of people with Alzheimer's disease will have alpha-synuclein deposits in the brain. Will ArtyQuick be helpful in distinguishing between these people and Parkinson's? The data need to show it. And for disease progression, again, I think that the answer currently is no, but in the future, if ArtyQuick becomes quantitative and can show us levels that we can show that we can reduce it with a certain drug, that will be exciting. But currently, we cannot tell that our ArtyQuick is just a yes-no study. So once you're positive, and the levels of alpha-synuclein, total alpha-synuclein in CSF, you saw, don't really change as the disease progresses. So in conclusion, I would say very promising alpha-synuclein in CSF, but the answer is currently no. Thank you.